So many children and adults inside of the Black and brown neighborhoods here in Houston are in so much need. 60% of the children in our communities are raised by their grandmothers. That alone tells you there's a need.
It is our responsibility to serve a medically underserved population. We've got hardworking families living in our communities that need a great school, need a great health provider, need a great place to belong.
As a country, we have become program service rich but system poor. There isn't one program or one service that can do it all. And therefore, for us to cause social sustainable change, we need to be part of the collaborative. And so what I loved about Vecino is, one, has the community been involved? Number two, how does this fit in a greater vision? Number three, how is it feasible and how are we gonna sustain this over the long run where it becomes something that is self-sustaining? These are the things that Vecino always has at the forefront.
One of the benefits of working at Vecino is that we do have a little bit more of a leeway to work with our patients, do full evaluations on our well checks, getting them services such as speech therapy, physical therapy, getting them involved in community organizations that provide early Head Start programs, which are really important to the communities here. And now we're trying to expand. We have found community partners that see what we're doing and they want us to bring that to other areas.
We're working with 3 other federally qualified health centers, looking at ways, how can we scale our organizations in the most efficient manner? Because as a group, we're in a better position to address those challenges than individually.
So we do have a very good relationship, and I think that helps us build a lot more positive synergy.
It relieves some of our staff to continue doing what they're doing, but yet we're consolidating that shared service and looking at shared costs, looking at economies of scale, and we're all focused on population health, which again is an indication of our success.
Conventional wisdom was people thought that, why do we need anything else if we've got the hospital district? But come to find out, they're only serving a third of the need. We're in the most uninsured county in the nation. One of the areas that we're really looking at is quality assurance. You know, right now, the way that the healthcare system is set up, it's volume-based billing. More you do, the more you get. Well, what we're moving to is more of a pay-per-performance. I mean, you get paid for, can you show that your patients are getting healthier? You know, are they staying healthy? We started with small projects like we're shared psychiatry that will provide services to all 4 organizations. You know, we're sharing pharmacy. We're looking at, administrative service organizations so they wouldn't be duplicated to all 3 FQHCs. We're partnering with neighborhood centers. We're working to do a community health center in Aldine. NCI, they're gonna build a 100,000 square foot facility there. We're gonna have 6,000 square feet within it. We're working in 2 other elementaries. We're trying to set up 2 school-based clinics.
It's not typical that schools partner with healthcare providers. We were very fortunate to be able to make the connection with Mr. Montes, and he said, hey, we can create a partnership if you're interested so that our students can receive counseling services and their families as well. So that's the new role that Vecino will be playing with us here at Scroggins.
I think what's really special about bringing an on-site pediatric clinic onto Kashmir Gardens campus is that we're dealing more in terms of a proactive method towards that sustainable future for our communities. ProUnitas provides the infrastructure. We're a system-based backbone organization, and Vecino was extremely open to making sure that, those conversations start with the community, before even anything happens.
Vecino was willing to step up and say they were committed and dedicated to being the medical home long-term for the entire family. That was really important for us when Vecino and Neighborhood Center started working in the East Aldine community. We are also working to create a school-based medical center for our early Head Start program in Fort Bend County.
We've already referred families to the clinic and have actually had parents come inquire about some assistance for their children. So I absolutely encourage anyone who has the time to tour the facilities and find out more by speaking to the great personnel that is there.
Houston's a great city. It has got a very vibrant philanthropic community. And I do think that there is a realization out there that hey, these people are Houston as much as any of us, any of the rest of us. All of us are one bad break away from being in need of help. And so, what I would say is that we're all in this together.
Organizations like Vecino, I applaud them very much. They are a necessity in our communities today.
Vecino have it right. The holistic model that they provide for our communities is exactly the thing we can all build on and that we need to continue to resource. Please join us.
Join us in this campaign.
Join us today and let health shine.
Let health shine.
Let health shine.
And let health shine.